And then finally, I'll talk a little bit about endometriosis, because endometriosis can change the environment where the egg and sperm are meeting in the fallopian tube. Endometriosis is, by definition, the endometrial glands and stroma that come out through the fallopian tubes back into the uterine cavity, back through the uterine cavity back into the peritoneal cavity. You know, when women menstruate, 90 to 95% of that menstrual blood goes out the vagina. But about 3 to 5% goes back through the fallopian tubes. And then that menstrual blood can then derive a blood supply from the organs within the pelvis. It can derive it from the peritoneal surface, the ovary, the fallopian tubes, the posterior cul-de-sac. And then it can set up residence there. And then normally your immune system will absorb that menstrual blood. But if you have a decrease in your immune system, or you have an increased amounts of blood going backwards, your body can't keep up with it, and then you start to accumulate glands and stroma within the pelvic cavity, and that is clinically called endometriosis. And so, as I mentioned, all women have some endometriosis, but it's their immune system that actually helps to remove it. And so there's physiologic endometriosis, but like when there's a disruption in the immune system, like for instance, I had a patient once that had to have chemotherapy, and she had a normal pelvis prior. When she had her chemotherapy, her immune system was disrupted. She then came up with an endometrioma later, about 6 months after she finished her chemotherapy. Again, the disruption in her immune system allowed her menstrual blood to accumulate within the pelvis and then gain access to the ovary. And as I mentioned, when the blood is sequestered within the ovary, it's called an endometrioma.